Hi everyone, today we are going to discuss the topic that is autocoids. So autocoids are the substance that are produced in our body whenever there is a condition of the tissue injury, and this include the substance like histamine, serotonin, prostaglandin, then leukotrienes, then platelet activating factors. All these substance come under the term autocoids, and autocoids are produced by specific cells in our body, and they are actually inflammatory mediator in our body. And the another term that is used for the autocoids is local hormone, because they are produced by specific cell like mast cell or enterochromaffin cells, and they act where they produce, means they act locally. They causes the inflammation or redness or swelling of specific part of our body. And these autocoids are classified as a amine containing autocoid, lipid derived autocoid, and peptide autocoid. Amine containing autocoid include histamine and serotonin. Lipid derived autocoid include prostaglandin, leukotriene, platelet activating factor, and in peptide autocoid, bradykinin and calidin. These are included. Um this autocoid uh, in this autocoid, the important one of the inflammatory mediator is a histamine. Histamine is stored in the mast cell, and when the antigen enter in our body, this antigen bind with a IgE antibody that is present on the surface of the mast cell, and the release of the histamine occur by the process of the degranulation, and uh, and further effects are produced by the histamine. And histamine, as you can see here, it is produced by the amino acid histidine in the presence of enzyme histidine decarboxylase, and it is metabolized by enzyme N-methyl transferase, and its metabolite is a N-methyl histamine. Chemically, histamine is a beta imidazolyl ethyl amine. Next part is, once histamine is produced, it act on its receptor H1, H2 and H3. These three receptors are very important in relation to the histamine. First, we will discuss about the location of this receptor. If we discuss about the location of the H1 receptor present on the blood vessels, like capillaries or larger blood vessel, but its action on the larger blood vessel and capillaries is different. H1 receptor causes vasodilatory action of the capillaries, and this vasodilatory action is mediated by the production of the uh, nitrous oxide. And in case of the larger blood vessel, histamine is responsible for the contraction of the larger blood vessel. And as H1 receptor is a GQ protein coupled receptor, it is responsible for the influx of the calcium, because it is GQ protein coupled receptor, and because of that it is responsible for the contraction of the uterus, contraction of the intestinal muscles, etc. And as it is present on the adrenal medulla, responsible for the release of the catecholamines, and it is present in brain also. Then next is a H2 receptor. H2 receptor location is a gastric mucosa. In gastric mucosa, histamine causes the increase in the gastric acid secretion. And next is a H3 receptor. H3 receptor is a different receptor than the H1 and H2 receptor. It is lazy receptor. It is autoreceptor, because the term autoreceptor means it is present presynaptically, and as it is present presynaptically, it is responsible to cause decrease in the release of the histamine. Whenever the receptor is present presynaptically, it is responsible to decrease the release of that particular neurotransmitter. Then H1 receptor is GQ protein coupled receptor, H2 receptor is a GS protein coupled receptor, and H3 receptor is a GI protein coupled receptor. Most of the time, whenever the auto receptor is there, it is GI protein coupled receptor. Then here the names of the selective agonist of each receptor are given, like H1 receptor selective agonist is a 2-methyl histamine and 2-thiazolal ethylamine. H2 receptor selective agonist is a dimaprid and impromidine, and H3 receptor selective agonist is a alpha methyl histamine. But as we have to mediate the effects that are produced by the histamine, or we have to antagonize the effect produced by histamine, because histamine is responsible for the allergic condition or inflammation or ulceration. The names of the selective antagonist of the histamine are important, because agonist action is not important, antagonist action is important in medical practices. So H1 receptor selective agonist are we are going to discuss in the later part, like you may heard about the cetirizine, levocetirizine, promethazine, diphenhydramine, dimenhydrinate. All these drugs are H1 receptor antagonist drug, and H2 receptor antagonists are used in the treatment of the gastric ulcer, like you may heard about the cimetidine, ranitidine, famotidine. All these drugs are H2 receptor antagonist drug. uh, and next is uh, a role of the histamine, pathophysiological role of the histamine, like gastric acid secretion. Histamine is present, it is responsible to increase the gastric acid secretion in our body, because H2 receptor is present in the gastric mucosa, and it increase the release of the gastric acid. And so we use the H2 receptor antagonist in treatment of the peptic ulcer. Then next is a allergic phenomenon. Histamine is responsible for the type 1 hypersensitivity reaction, immediate hypersensitivity reaction, which is mediated by the IgE antibody, and which lead to the condition like angioedema, means swelling of lips, then redness, swelling, inflammation, then urticaria, that is irritation in the genital areas. All these effects are generated due to this inflammatory mediator. Along with allergic condition or inflammation condition mediation, histamine is involved as a neurotransmitter also, because histamine is present in the brain in some amount, and it is responsible to maintain the wakefulness of the living beings. And that's why whenever the H1 receptor antagonist, especially first generation H1 receptor antagonists like promethazine or diphenhydramine or dimenhydrinate are prescribed in the patient, they are responsible for the sedation or responsible for the drowsiness in the patients. And as well as histamine is involved in the maintaining body temperature, then thrust and all cardiovascular functions. Then as we discussed before, histamine is responsible for the dilation of the capillaries, it is responsible for contraction of larger blood vessel. And when histamine is given intradermally, it produces the triple response, that is flare, wheal and red spot. Means it is responsible for exudation of the fluid, and redness, swelling or itching in that area. All these effects are generated through the effect of the histamine on blood vessel. Then next part is a antihistaminic drug. Antihistaminic are those drugs which block the effect that are produced by the histamine. So this actually of the two type, that is H1 receptor antagonist and another is the H2 receptor antagonist. H1 receptor antagonist and H2 receptor antagonist. H1 receptor antagonists are further classified in the two categories, that is first generation and another is the second generation. First generation drug are different from the second generation drug. Second generation drug are more advantageous over first generation drug. Here some points are discussed about the H1 antagonist first generation and H1 antagonist second generation. So what is that? H1 antagonist first generation can cross the blood brain barrier, and as they can cross the blood brain barrier, they antagonize the H1 receptor present in the brain and causes the drowsiness, sedation. They causes the anticholinergic effect, means dryness of mouth, then a decrease in the gastric acid secretion, blurring of vision. All this is produced by the H1 antagonist. And H1 antagonist second generation means they have some advantages, that they do not cross the blood brain barrier, they do not cause the sedation or drowsiness, and no anticholinergic side effect, means no blurring of vision, no less sedation or less dryness of mouth is associated with H1 antagonist second generation. And remember that H1 H1 receptor antagonist second generation are not H2 receptor antagonist. You may confuse that second generation and H2 receptor antagonist. This is different. These two terms are different. H2 receptor antagonist means cimetidine, ranitidine, famotidine. They are used in the treatment of gastric ulcer. And H1 receptor antagonist second generation and H1 receptor antagonist first generation, both are used in the treatment like allergies, cold, cough, etc. Here the classification of this drug are given, that is H1 receptor antagonists are further classified as a highly sedative, then moderate sedative and low sedative. Highly sedative include drug like diphenhydramine, diamine hydranate, promethazine and hydroxyzine, means DDPH. You can remember this trick. And moderately sedative, that is meclizine, buclizine, quinarazine, phenyramine and cyproheptadine. And low sedative, that is cyclizine, triprolidine, chlorpheniramine and dexchlorphenyramine, means chlorpheniramine uh, and dexchlorphenyramine. Then second generation, that is cetirizine, levocetirizine, terfenadine, fexofenadine, astimizole, azelastine and misolastine. All these drugs are included as a second generation antihistaminic drug. And Here highly sedative drug, name of the highly sedative drugs are given. These drugs are contraindicated in the patients who are involved in the operating heavy machines or who are truck drivers, because they cause sedation. And then next part is a here you can see that terfenadine is a here you can see that fexofenadine is an active metabolite of the terfenadine. And terfenadine is responsible for the torsade D point. Okay, it is responsible for torsade D point. It is ban, actually this drug is ban. Astamizole is also banned in India because it causes a torsade D point. And uh, uh, cetirizine and levocetirizine, levocetirizine is a L isomer of the cetirizine. Then if we discuss about the use of the antihistaminic drug, uh, here we have firstly discussed the use of the first generation antihistaminic drug, that is anti-allergic action. All antihistaminic drug H1 antagonists are used to manifest the effect of the histamine of the hypersensitivity, because as histamine causes the urticaria, angioedema, itching. These all things are suppressed by the antihistaminic drug. Then motion sickness, as we know that hyoscyamin anticholinergic drug is used to treat the motion sickness. But in antihistaminic drug, promethazine or dimenhydrinate, these drugs are used to treat the motion sickness. Then promethazine is also used in the treatment of the parkinsonism. Then Kinarazine is useful to treat the vertigo. Then acute muscle dystonia means uh, unwanted movement of the neck or face. This all treated by the promethazine, diphenhydramine, hydroxyzine. And here promethazine, diphenhydramine or hydroxyzine, why they are used in the acute muscle dystonia? Because they have side by side anticholinergic action also, along with a antihistaminic action. And that's why they are used in the treatment of the acute muscle dystonia. And another is a ulcer. In the treatment of the ulcer, H2 antagonists are used, not second generation antihistaminic drug. H2 receptor antagonists are used in the treatment of the ulcer. Then as a apoptotic stimulant, apoptotic stimulant cyproheptadine is a appetite stimulant drug. Means those drug that increases the appetite, means जो भी ड्रग होती है वो भूख इंक्रीज करती है, that are appetite stimulant. And cyproheptadine is used. Cyproheptadine is a drug that possesses antihistaminic as well as anti-serotonergic activity. Remember, an appetite stimulant drug also called as oroxigenic drug. And next is a use of the second generation antihistaminic drug. This drug include fexofenadine, then loratadine, cetirizine, levocetirizine, azelastine, alkaptidine, rupatadine, and olapeptidine. So, fexofenadine is an active metabolite of the terfenadine, and terfenadine, as we discussed before, it causes the torsade D point. So it is banned in India. And loratadine is a one of the non-sedating second generation antihistaminic drug. Cetirizine we use commonly in the allergic rhinitis. And levocetirizine is a levoisomer of the cetirizine. Then azelastine, alkaptidine, and olapeptidine, these antihistaminic drugs are used topically. Out of that, olapeptidine is used in the allergic rhinitis in the form of nasal sprays, and alkaptidine is used in the eye conjunctivitis. And azelastine is also used in the treatment of the seasonal and perennial rhinitis. And rupatadine is an antihistaminic drug with additional platelet activating factor inhibitory activity. Means it is antihistaminic as well as it can inhibit the action of the platelet activating factor. So this is all about the histamine and antihistamine drug. In this topic, the role of the pathophysiological role of the histamine is necessary to be understood. Then next part, important part, is the classification of the drug. And third, that which drug is banned in India, or which drug is used topically. Or another important part is a use of all antihistaminic drug, because promethazine drug is very famous drug. Then cyproheptadine is also important. Cyproheptadine is prescribed in the children's especially, because it stimulates the appetite. So this is all about the antihistaminic drug.